My name is April T. Roldan, and I'll be presenting on the effects of dance on balance outcome measures in people with Parkinson's disease. To give you a brief background on Parkinson's disease, it is the second most common and progressive neurodegenerative disease that affects dopamine levels in the brain that helps with movement, action, cognition, memory, and reward-seeking behavior. Its prevalence is at about 1% at age 60 and increases with age. With abnormal dopamine levels, in the early stages of Parkinson's, we can see rigidity, tremor, slowed movements, balance deficits, and shuffled gait. In the later stages, we see one's inability to take care of themselves, sometimes requiring one-to-one care, and at times cognitive decline. At any stage of Parkinson's, one can experience falls. Current pharmacological treatment includes levodopa and may lead to a sedentary lifestyle due to motor and mental symptoms. So my case scenario includes Mr. Miyagi, who's a 67-year-old man, married and retired, 40 years as an accountant. He was diagnosed with Parkinson's disease 2 years ago and presents to clinic with complaints of instability and one fall. His current treatments include levodopa. His prior level of functioning includes independent with ambulation and activities of daily living. His patient goals include along spending time with his wife, continuing to pursue dance as a hobby, and maintaining independence so long as he is safe. Hoehn-Yahr is one of 6 parts of the disease rating scale for Parkinson's. Mr. Miyagi presents to us with what seems to be stages 2 to 2.5, now affecting his balance. Upon examination, Mr. Miyagi scores 4 seconds, 300 meters, and 25 points less than normative values for community-dwelling elderly in balance outcome measures. Which leads to my PICO question: what are the effects of dance for Mr. Miyagi on the progression of his disease and its effect on his balance? I used PubMed, Web of Science, and CINAHL. 298 articles were waxed on, 290 articles were waxed off, to yield 8 articles included in this presentation. It is safe to presume that all of the articles found within my search included some type of dance intervention. However, I'd like to highlight some of the distinct characteristics among the studies. Almost all were randomized control trials with the exception of one case study. Almost all subjects were Hoehn-Yahr stages 1 to 3 with the exception of one Hoehn-Yahr stage 4. And there were different conditions to the dance. For example, one was comparing to exercise, one was partner and non-partner, and another was tango versus ballroom. One study looked at Irish dance, one study looked at virtual reality. The shortest intervention was 6 weeks, the longest was 2 years. Our results is as stands. I decided to divide it up into 3 categories: stage of Parkinson's, length of dance intervention, and type of dance and what they matter in balance outcomes. First, we'll go over the stages of Parkinson's. Averages were taken from 2 studies whose subjects were diagnosis only, in which the stage was not specified. And we see within the green boxes that one of the 2 studies shows significant improvements in the Berg balance and timed up and go scores. Next, averages from 4 studies whose subjects were stages 1 to 3 show 3 of the 4 studies yielding significant improvements on the Berg balance scale, as depicted in the middle graph. One of the 4 studies shows significant improvements on the 6-minute walk test, as depicted in the third graph. From the one case study whose subject was stage 4, we see significant improvements on the Berg balance scale. So what's our takeaway from all of this? Does Mr. Miyagi's stage of Parkinson's matter in his balance outcomes? Of the 6 studies presented in the previous slide, with stages 1 to 3, we see significant improvements for the timed up and go. For stage 4, we see a significant improvement for the 6-minute walk test. And most impressively, with all stages, we see significant improvements in the Berg balance scale. The second category we'll go over is, does the length of dance intervention matter? We see of the 4 studies utilizing 6 dance conditions, meaning partner, non-partner, ballroom, or tango, one study shows a moderate effect size for the timed up and go at 1 year of intervention. Here we see of the 6 studies utilizing 7 dance conditions, 2 studies show moderate to high effect sizes for the Berg balance score at 13 weeks, 6 months, and 1 year of dance intervention. And finally, we see of the 2 studies representing 3 dance conditions, we see moderate effect sizes for the 6-minute walk test at 13 weeks of dance intervention. So what's our takeaway from all of this? Does it matter the duration of dance intervention for Mr. Miyagi for his balance outcomes? Of the 7 studies presented here, we see that with varied durations of dance intervention, moderate effect sizes with the timed up and go and 6-minute walk test. And again, most impressively, interventions greater than 13 weeks, we see high effect sizes with the Berg Balance Scale. Lastly, does the type of dance matter? Would it matter for Mr. Miyagi if he did the cha-cha, the macarena, the salsa, or a tango? Results from my research show low effect sizes for partner, non-partner, and virtual reality dance. Moderate effect sizes for ballroom, tango, and Irish dancing. And again, most impressively, a high effect size for ballroom and tango on the Berg Balance Scale. So for discussion, low to moderate quality level 2 to 3 studies show improvements in balance outcomes. Many of the results were significant, but all were still improvements. Dance is a great non-pharmacological approach to treatment of movement symptoms from Parkinson's. And interestingly, there were other areas of improvement. We see with earlier stages of Parkinson's an improvement in freezing of gait and disease severity. And more notably, we see that with only 6 months of dance intervention, high effect sizes for freezing of gait and disease severity. We see in 2 studies an increase in health-related quality of life and a decrease in depression score. And I think it's impressive to note that here we have an intervention that not only improves balance outcomes, but also improves disease severity of a knowingly progressive disease. Limitations include lack of description of dance intervention, lack of disease stage specification, lack of blinding, follow-ups, and medication controls. In addition to possible ceiling effects with some of the outcome measures, small sample sizes, and possible dance instructor bias. We don't know if a dance instructor preferred ballroom over tango or partner over non-partner. So what's my application to Mr. Miyagi? What is dance? Dance is essentially rhythmic movements with auditory cueing and haptic feedback. For Mr. Miyagi, I would first educate on movements without the music, and upon mastering progress, I would then incorporate music. I would see him 2 times a week, 1 hour each, simultaneously incorporating strength and endurance training. I would then refer him to some local resources. I was fortunate enough to start volunteering for Dance for Parkinson's, located in 43 states here in the U.S. and 16 countries, whose primary focus was to emphasize movement, music, and a sense of community. At the end of every volunteering session, we would hold hands as shown in the video and thank each other. Thank you for dancing with me. Thank you for coming. And in turn, I'd like to thank you. Thank you to my classmates, to my professors, and to my family. Thank you for all of your love and support. And this concludes my presentation.